We're holding this informational picket because the conditions at our hospitals are negatively affecting our patients, nurses, and our whole community. We're calling on hospital executives to improve staffing and patient care and address the significant nurse turnover problems that we're facing. During the pandemic, our nurses rose to the occasion. We put our health and the health of our families and friends on the line to care for the extremely sick patients within our hospitals. We pushed through despite many challenges and helped our community get through to where we are now. We are simply asking the hospital executives to step up and do the same.
At our facility, nurses can have up to 5-6 patients. We have vital signs. We have telemetry strips we have to read. We have critical labs that we need to take, notify the provider. We have head and shoulder assessments. We have patients sitting in soiled linens because there is not enough staff to go around. We have bed alarms going off with people on the floor. It is unsafe. And it's not okay. And we're gonna stick together and we're gonna get through this and we're gonna ask management to step up and help.
Our patients have become older, sicker, multiple issues. They have breathing problems, heart problems, diabetic, not walking around, amputations. There's so much we have to know and so much we have to do to take care of them, to keep them from going into a nursing home. We want our patients rehabbed and to go home to their home because we have good, healthy staffing to take care of them. And that includes aides. We don't have enough aides either. Because without aides, we're doing their job and we can't do our job. We need to thank our aides for them coming in, and we need more aides too. They're very important.
Unions stick together through labor councils because if it was just your union, this wouldn't be as powerful. But when the teachers and the IBEW people and the GE workers and the painters show up, it's because we're all part of this community, and we just have to stick together, because if they could, they would tear us apart, and we're not going to let that happen. So there you go.
So I want to appreciate and thank the nurses that came out to our meeting last week and let us know what was happening here. We're going to spread the word across the 50 unions that are part of our council, and we're going to let people know that we have to stand up for nurses at the Beverly Hospital, and we have to beat the Northeast Hospital Corporation at their greedy game of not staffing enough nurses. So thank you in solidarity.
We are exhausted. We are being pushed to the brink. We do not have enough time with our patients when we are giving excessive patient assignments. Patients go too long without moving around, resulting in unnecessary complications and higher likelihood they end up in a long-term care. Patients miss education. They need to thrive so they can get home. Lack of staffing can lead to more falls, injuries, and medication errors.
You know, I just have to say, I'm a night nurse. I work the night shift. And when I heard that a nurse had worked from 11 o'clock at night until 2:30 the next day, what are they thinking? What are they thinking? And I'm so glad that you're out here standing up for that nurse. The Commonwealth had initially blocked the merger out of concern for how it would create this profitable corporation. And then the AG conditioned it because B.I. Leahy said they would use this to improve care in the community. 5-6 patients, double shifts, doesn't sound like improving care in this community to me. And they made a legal commitment to invest in public health. And how are they living up to this commitment? By failing to adequately staff Northeast Hospital Corporation and by failing to provide you the conditions to provide that care. How are they living up to that? You know what? They're not. And thank you every day. I'm thinking of you every day, and everyone across Massachusetts is thinking of you and the work you're doing every day.
Thank you, Katie.